Hi, my name's Greg Fell. I'm Director of Public Health for Sheffield. A lot of people have been asking me over the last week or so, what does social distancing actually mean? I'll give a few thoughts. One, there's something about the difference between social distancing and physical distancing. Physical is probably the really most important thing. Social implies that we don't want you to talk to other people. We don't want you to interact. No, we do, because that becomes really important. But it's the physical difference, the physical distance that is the thing that matters. So what are the messages? Basically, stop non-essential contact with others, stop unnecessary travel, shouldn't really be making the trips of any description that aren't really necessary, work from home where you can, avoid gatherings. That includes clubs, confined spaces, includes religious gatherings. There may well still be some churches that are still open, includes family gatherings that don't include your immediate household, and it does include playgrounds. I know where my kids are today, they're at home, and when we say stay at home, we do mean stay at home, not go to the park or go to the DIY store or go to some other place that may still be open. The risk is probably the risk of transmission is probably greater in a large number of small groups than one big gathering. So it's really important to be clear on some of that stuff. How far? 6 feet, basically, about my height. What we're trying to do is limit the number of opportunities that the virus has to spread. The more that we limit the virus and how it can spread, the slower and the less the takeoff of the epidemic. And the evidence is really clear. That's beginning to play out, and that's great news, but it doesn't mean that we can all take our foot off the gas. The social distancing measures are going to be in place for probably a good few weeks to come yet. My guess is 12, 13 weeks or so. And it's the best thing we can do in the absence of a vaccine to protect others. So why does it matter? There are lots and lots of really techie explanations on social media and elsewhere. The council's put a fair few of them out. There's one that's circulating at the moment. If I limit my contact with others by 50%, then in 5 days, I'm going to have infected 2.5 people. In 30 days, that comes 450 people become infected. If I limit my contact with others by 75 or 80%, then in 5 days, that becomes about half a person that's infected. And over 30 days, that's 2.5 people infected. So compare 450 infected people to 2.5. That makes a massive difference. As I say, there's lots of other explanations on the internet, but the upshot of all of it is staying at home. One, protects the NHS and enables the NHS to prepare to care for your and my loved ones when they will become really, really poorly. And two, saves lives. And that, I don't want to sugarcoat that. Staying at home really, really does save lives. Social distance really, really saves lives. I'll leave you with the words of the Director General of the World Health Organization. He said a week or so ago, our choices have an impact on others. We can choose to make choices for ourselves. And I know there'll be groups of young men out in Sheffield today. They can choose to become infected and whether or not they take the chance of a mild illness. And it's fair to say that there are some young people that are getting very, very severe illnesses. So, young people can choose to take that choice. But if that puts pressure on the NHS that it will be very difficult for the NHS to cope with, those choices will have an impact on the lives of our loved ones, and that is why it really matters. That is why it really matters. We know it's hard, but reducing the size and the spread of the epidemic might be one of the things that best protects our loved ones, and I think we should all consider this.